Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to start today's update with a review of our most recent positive COVID-19 cases in Dare County. The number of positive COVID-19 tests in Dare County is now 42. Since the last Dare County Department of Health and Human Services update, issued Friday, June 12, 2020, there have been 10 new cases. There were 3 new cases over the weekend, 4 yesterday, and 3 more were reported this morning. The Dare County website has already been updated to reflect all of these cases. Of the 10 cases reported since June 12th, 5 are residents and 5 are non-residents. The 5 residents are symptomatic and recovering in home isolation. 4 of the cases are connected, and it is believed that one individual acquired the virus by community spread and then spread the virus to 3 other family members or close contacts. The other positive resident is not connected to the other 4 cases. However, this case is also believed to be acquired through community spread, as the source of how the virus was contracted could not be determined. Of the 5 non-residents, 1 is symptomatic and the other 4 are asymptomatic. 3 of the asymptomatic cases are connected. They shared a common household and acquired the virus through direct contact. The other 2 cases are not connected, and we have determined one acquired the virus by direct contact outside of the area, and the other likely acquired the virus by community spread when outside of Dare County. All 5 of the non-residents have returned to their county of primary residence, and we have transferred those cases to the respective counties. There is no determined connection between the residents and the non-residents who recently tested positive. Contact tracing has been completed on 9 of the 10 cases, and all direct contacts of those 9 cases have been notified. The 10th individual has been unwilling to cooperate with us at this point. We will continue to pursue measures to identify direct contacts associated with this case. Direct contacts are those who the individual that tested positive identifies as being within 6 feet or less for 10 minutes or greater. If the individual identifies someone associated with a business or restaurant or other establishment as a direct contact, but does not know the name or contact information of the individual, we will work with that place of business to identify the individual and obtain contact information. When we are contact tracing a non-resident, we identify any direct contacts the individual had when they were in Dare County during their contagion window. We monitor all positive cases daily throughout their isolation period. When a non-resident leaves the county, we transfer their case to their county of permanent residence. I feel like a broken record at times, but I must stress again how important it is for all of us to practice the 3 W's: wear, wait, and wash. Wear a cloth face covering when in public. Wait at least 6 feet apart from others, and wash your hands frequently. We know several of the recent cases occurred through asymptomatic individuals unknowingly spreading the virus to others. We also know that while there have been 42 reported positive test results in Dare County, there may be many more people who have the virus in our community who we don't know about. While contact tracing helps us quickly identify and quarantine close contacts to help reduce the spread, the other ways to control the spread of the virus are beyond DHHS control and rest in the hands of the public. What you choose to do or not to do can directly influence not only your chances of getting the virus, but also the chances others around you will contract the virus. Personal responsibility plays a key role in helping reduce the spread of COVID-19. I will now provide an overview of the 4 key metrics we monitor as part of our disease investigation and surveillance. The metrics are number of tests, confirmed cases, positive test as a % of total test, and COVID-like illness surveillance. While the previous 2 weeks had an overall higher number of diagnostic tests performed, 179 and 205 respectively, those occurred at the drive-through testing events. This past week had the highest number of tests performed by healthcare providers in Dare County at 273 tests. This was an increase from the 169 conducted last week. We had 3 positive cases between June 7th and June 14th. The percent of positive tests to overall tests in Dare County since we started testing in early March remains low at 2.09%. The syndromic surveillance of individuals who presented to the emergency department with COVID-19-like symptoms last week remained low. These graphs can be found on the Dare County website at darenc.com/COVID-19. The Dare County Department of Health and Human Services is finalizing plans with Mako Medical Laboratories for the next community testing clinic for diagnostic and antibody testing, which will be held on June 30th. Since antibody testing requires a blood draw, not a finger stick, this event will be held indoors at the Dare County Parks and Recreation Facility in Kill Devil Hills. Details including when individuals can begin to schedule appointments, cost of the antibody test, etc., will be released by the end of this week. We encourage you to stay informed by visiting darenc.com/COVID-19 or visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.